Respiratory bypass, otherwise AMBU bag. History of AMBU bag. The bag valve mask concept was developed in 1953 by the German engineer Dr. Hodgson Hesse and his partner, Danish anesthetist Herling Ruben, following the initial work on a suction pump. Manual respiratory bypass. It's an essential emergency skill. Basic airway management technique allows for oxygenation and ventilation of patient until a more definitive airway can be established. Use of MRB to ventilate a patient is frequently called bagging the patient. Purpose. Additional oxygen may be administered by means of tubing from an oxygen source to the bag. It is used as part of CPR when breathing is absent or inadequate. It is also used to temporarily increase the oxygen supply as part of a routine respiratory care for a patient on a ventilator or with a gastrostomy tube. Manually ventilated client when off ventilator and unable to breathe independently. Indications of MRB. Acute respiratory distress or arrest during assistance to reach the adequate ventilation. No respiration or brief ventilation. Brief irregular gasping breaths. Unconsciousness. Transfer the patient one unit to other unit. This is AMBU bag. AMBU bag, self-inflating bag. You can see the parts of AMBU bag: mask, then pressure gauge, self-inflating bag, oxygen connector or tubing, oxygen reservoir. AMBU bag. It's a handheld device used to provide positive pressure ventilation to a patient who is not breathing or who is breathing inadequately. It is a normal part of resuscitation kit for trained personnel such as ambulance crew. The device is self-filling with air, although additional oxygen can be added. Valve. Valve prevents the backflow of air secretion into the bag. It prevents the bag from contamination. Bag valve mask sizes. 500cc bag if weight less than 60 pounds. 800cc bag if weight less than 100 pounds. 1200cc if the weight over 100 pounds. Additional components. Filters. A filter is sometimes placed between the mask and the bag. It can be placed before or after the valve to prevent the contamination of bag. Pressure relief valves. A pressure relief valve, often called pop-up valve, is often included in pediatric versions, sometimes in adult versions. It prevents the overinflation of the lungs. How it works. The BVM directs the gas inside it via a one-way valve when compressed by the rescuer. The gas is then delivered through the mask and into the patient's trachea, bronchus and into the lungs. In order to be effective, a bag valve mask must be delivered between 500 to 800 millimeters of air to one adult patient's lung. In case of two persons are there, one person the head and hold the mask firmly in place to keep the tight seal. The other person to compress the bag with two hands. Watch to see if the chest rises with each breath. If not, reposition the head and assure there is a good seal of the mask over the mouth and the nose. breathing rate per minute 20 to 24 for infants, 16 to 24 breath for children, 12 to 16 breath for adolescents. Two-hand method. You should hold the mask very tightly. Then you can see the complications of bagging, apprehension, anxiety in the conscious patient, gastric inflation, barotrauma, undesirable cardiovascular effects such as hypotension. Conclusion. The device is a normal part of resuscitation kit for trained personnel such as ambulance crew. Education and frequent refresher training are likely the keys to improve the performance. Thank you.